Cancer. Call Dr. Lederman. 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman. 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. We're back, taking your calls if you want. A few years back, everyone thought, wow, the key to avoiding cancer was fruits and vegetables. And in fact, there was a report in 1997 that was the turning point. At that time, the conclusion was diets containing substantial and varied amounts of vegetables and fruits will give a 20% reduction in the rate of cancers. Well, this paper just came out this week in the New York Times on April 24th, and it's been revised. Now, from 1997, it was rare, and the author of this paper is George Johnson. He said it's rare to see an unequivocal statement on scientific work on nutrition and health. And at that time, there was thought to be convincing evidence that the risk of some cancers could be reduced by diets heavy with produce. Now, with 10 more years of research, cancer experts had hoped the benefits would even be greater. But in fact, it's just the opposite. Gone entirely from the newer report was the bold declaration that fruits and vegetables alone would substantially reduce the cancer rate. It was demoted to murkier status. Rather than convincing from 15 years ago, it's now down to maybe or possible. The strongest advice involved exercising more and reducing obesity. And eating more apples and oranges might mean eating fewer candy bars. That would be a good thing. Now, Dr. Willett from Harvard in 2010 said it was a disappointing turn of events in a commentary called Fruits, Vegetables, and Cancer Prevention, Turmoil in the Produce section for the Journal of the National Cancer Institute. So a prestigious doctor at a prestigious hospital in a prestigious journal saying that there was turmoil in the produce section. Well, why? He described the reversion of conclusions in the 1997 and 2007 report, adding that more research from a large European study strengthened the evidence that any association of the intake of fruits and vegetables with risk of cancer is weak at best, weak, W-E-A-K, and that a broad effort to increase consumption of fruits and vegetables will not have a major effect on cancer incidence. So, what should be the focus? Well, it's pretty simple, and it's not so strange. There needs to be heightened efforts to reduce smoking and obesity. That's really simple, right? Stop smoking. If you take a 30-year-old, stops him or her from smoking, he will or she will add 10 years of life. Take a 40-year-old, stop smoking today, they'll add 9 years to their life. That's great dividends. That's better than the bank. So, number one, stop smoking. Number two, if you're obese, lose the weight. And all the other stuff seems to be garbage. Garbage. Okay, here's a new case. I want to talk just about this case. This is a woman who came. She was born in Iran. She moved to Israel. She's 46 years old. She could feel nothing in her breast, but she had a mammogram done on April 2nd and had subsequent views and had a 1.1 centimeter tumor in the right breast at the 6 o'clock position. It was close to the chest wall. She had a biopsy with a little needle in the breast. It doesn't hurt. You can numb up the skin. It was positive for infiltrating cancer. So this is a woman with a new breast cancer, 1 centimeter, so that's about 1/3 of an inch. It's called a T1. It's the smallest stage, T1, 2, 3, 4. This is T1. Physical exam, in fact, I could feel the mass in the breast. It was more than that size now, and that could have been from the biopsy. There was no spread to the lymph nodes. So what does she need? Well, number one, she has her choices, and every patient has choices to be treated, how to be treated or not to be treated. She has a very early cancer. Most women that I see understand that the chance of successful treatment is high or higher with lumpectomy. That's removing the lump of cancer and then giving some radiation to the breast versus mastectomy. I know some women think falsely that by removing the breast, they're going to do better. That's not the case. Some women think falsely that removing the breast, you're going to avoid the radiation. Well, if the cancer is spread to the lymph node, you're not going to avoid the radiation. Studies have shown improved survival, more women alive cancer-free who get the radiation in that case. So she's very motivated to save her breast, to save her life, and to continue on as intact as she can be. And I can tell you in my experience that lumpectomy and radiation is a superb option for most, not every woman, but for most women. When I came to New York in 1987 at Harvard, where I trained and worked, 90% of the women had lumpectomy and radiation. They saved their breast. Here in New York, one of the big cancer hospitals, 97% of women had mastectomy at that time because the hospital was dominated by surgeons who wanted or did or believed falsely that mastectomy was better. There are multiple studies now, including multiple randomized studies, that show that is not true. A woman can have a high likelihood of being cured, have a high likelihood of keeping her body intact with good cosmetic results. And I can tell you that a reconstructed breast is nothing like what God gave a woman. Not the same form, it's not the same sensation, it's not the same shape, doesn't have the nipple areolar complex like a normal breast. And that's what we try to achieve and most commonly achieve in a woman is to keep that breast intact, keep her intact. And in my experience, after the treatment, a woman goes back to her normal life, and with the breast intact, she pretty much even forgets that difficult episode of the breast cancer. So this woman, 46 years old, from Iran, via Israel, here in the United States, for many, many years, with a small tumor, most likely is going to do great. And she gets to decide, every patient gets to decide themselves when they hear all the choices. So we wish her well and wish everyone well, in fact. Go on. And in the good news department, yes, we have more good news, and this is also what is radiosurgery department. So this gentleman came to us. It's about an 80-year-old man with esophageal cancer. Esophagus is the tube between the mouth and the stomach. He was developing difficulty swallowing. He couldn't swallow. That's when the cancer was diagnosed. He had the usual routine therapy elsewhere, chemoradiation surgery, and then came to us when the cancer grew back. Everyone told him, biggest hospitals, you can't do anything about it, you should go home on hospice. He didn't like that. Couldn't eat, was miserable. He should go home on hospice, being miserable. Didn't sound like great news to him. He came to us, he came just a few weeks ago. We treated him. We offered all the options, including no treatment, chemo. I offer everybody everything. It's up to the patient to decide. I don't decide for the patient. I don't believe a doctor should decide for the patient. A doctor should make the options for the patient, and the patient should be informed, and all their questions should be answered, and there should be plenty of time for all their questions and their family's questions. He decided, even though other places told him you can't have more radiation, you had radiation before, you can't do it, you should go home, that's it, it's the end of your life. He chose to be treated with radiosurgery. So radiosurgery, again, is a non-invasive technology. We make a stereotactic frame of the patient. We focus the beam just on the cancer area, try to avoid the healthy tissue. 5 treatments. Each treatment's about 15 minutes. Well, he had 1 treatment, 2 treatments. Asked him how he was doing. He says he's getting better. He's eating again. After 2 treatments, 15-minute treatments, he was eating again. And he came in Friday after his 5th treatment, and he's eating steak and meat and all the things he likes to eat. And he's happy. He married his wife, a Filipino woman who was the nurse for his parents. Actually, the majority of nurses in New York City are from the Philippines. He married a Filipino woman. They've been married for many, many decades. She's very supportive. He's feeling so good. On Friday, they told me they're going to go to Philippines for a family reunion for a month. But before he goes, he's got a couple other sites, wants us to treat those sites with radiosurgery, and then he's going to go. And, of course, every 3 months, our usual practice is to get follow-up tests to prove to the patient, to prove to the family, to prove to us that the treatment is working as proposed. So that's what is the good news department. That's what's radiosurgery. Gives some people a first chance, some people a second chance, some people a third chance. For this man, it allowed us to give him a treatment, open up his esophagus, get him eating again, feeling great, no symptoms, eating steak, planning his future. That's good news. Great news. So we're going to hear a little bit from our sponsor. And again, some people say I don't say this enough, so you're welcome to call. We're at 1-800-321-0710. 1-800-321-0710. You're welcome to call us. Oh, did I tell you, by the way, we use hyperthermia. We're one of the few facilities in America with hyperthermia equipment made in America, the US of A. Hyperthermia has been known for actually 2,000 years to heat up the cancer and increase the chance of chemo or radiation working in combination with hyperthermia for certain tumors. So the beauty of hyperthermia is, again, it's totally non-invasive outpatient therapy. It allows us to heat up tumors, especially those superficial in the breast and skin and head and neck and some other metastases. We've treated some sarcomas of the arm, melanomas, basal cells. So hyperthermia is a treatment you may want to explore. You may want to talk to myself or the doctors or the staff at Radiosurgery New York. So hyperthermia, I just wanted to mention today because I haven't mentioned it in weeks. And we're going to be back in a moment with a word from our sponsor.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within 1 business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. We're back live and taking your calls and talking about cases. So we just spoke about an esophageal cancer recurrence, treated, and now the man is eating, doing well, and planning a trip to see the family in Philippines. He's from Italy. His wife's from Philippines. But a new woman, new to us, came in this week, May 1st, with esophageal cancer. Here's her story. She's 62 years old, from India. She has 4 children. She has a husband.